Hi, all. Thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Dr. Harsh Trivedi, who is the president and CEO of Sheppard Pratt. This was such a fun interview. With so many of our interviews, we don't really know where we're headed with them, and they take a totally different direction like they did last week with Christy Doherty. Didn't think we'd talk about their strategic plan the whole time, but we did. And this one, Sheppard Pratt has done mental health and substance abuse for so long, but did not expect that so much of the success would be about his leadership style in the last 6 years that he's been there. I just love the different way that he thinks about things. He is so tied to the mission and the values of Sheppard Pratt and how they were founded and really serving the community. And he said multiple times, I can't find the direct quote, but it was something about finding the need that's unmet and working towards that. So they're really hyper focused on making sure that they're delivering what the community needs. But then he's also incredibly focused on the team, making sure that everybody's on the same page and being very humble about accepting feedback and how he wants people to tell him if something's not the way that it should be, or if he has a blind spot to something. And I love that he kept talking about how the organization is very flat, how they run on an incredible, 14%. It was just everything about what he was saying was so amazing because he's so tied into the community, but his people. And I just couldn't get over the way that he's walking that balance between running this organization while still focusing on both of those areas so intensely. Apoorv, what were your takeaways?
I agree with your thoughts, Stephanie. I mean, such a wide range of areas that he's covering in terms of his leadership approach and style, and clearly being able to connect the dots. I think that's why he's able to be so effective. He's really attentive to his people, building the right team, creating trust, breaking down silos. It's a labor of love for him and a passion that he, clearly understands because he knows that without doing that, so many well-laid plans can go awry as silos start to get created and people start protecting their turf. So it's a great lesson in management and kind of being hands-on leader and really taking the opportunity to kind of get his people together and make sure they reconcile their challenges. And then ultimately, they may disagree with each other when they're in the room, but once they step out of the room, be able to stand together. But really appreciated all of the lessons that he had to share. I think the his personal story and inspiration of kind of what he was talking about when he was in medical school and getting inspired to actually take on healthcare at a systems level sounds like maybe where he got his inspiration to say, hey, if this is not about the individual patient and it's about overall patients, then it's not about me either as an individual, but me as an agent to be able to help create a system that can help deliver the right care for the overall population. So I find his story, like you, to be extremely inspiring, and I'm really grateful that our audience has had a chance to listen to his journey.
Absolutely. And if you didn't have a chance to watch the interview yet, be sure to go back to Tuesday's interview post and watch that because it is a fabulous lesson in leadership. Thanks so much for watching, and we'll talk to you soon. Bye-bye.
Bye bye.